This is a short video for Module 4 on ethical decision-making frameworks. And this module should assist you in completing assignment 4.2 and applying this ethical framework to a case study. Nurses struggle with ethical concerns daily in their practice. We use ethical decision models each time an ethical decision comes up, even though the model, we may not call it by name. Ethical dilemmas involve situations where a choice must be made between alternatives, but none is ideal or a clear choice, and usually strong emotions are usually tied to the issue. When making an ethical decision, we must consider the factors influencing the nurse's ability to respond to the ethical dilemma. First of all, we must consider the nurse's perception of his or her level of influence within the healthcare setting. If the nurse is involved in the patient's care where the decision needs to be made, then the nurse needs to be one involved in making that decision. If the nurse is not involved, the nurse does not need to be a part of this decision unless the decision is critical. The nurse must also consider their level of clinical expertise and competence. Does the nurse have the clinical knowledge or competency to make this decision, or does this decision need to be a part of a healthcare team? The nurse needs to consider the degree of ethical concern. Is this really an ethical decision? Or does the nurse just not have the clinical expertise to make a healthcare decision? You need to also consider the nurse's past experience with ethics education. If the nurse has not been educated to make ethical decisions, then they need to consult their healthcare team. One way to begin resolving ethical dilemmas is through ethical decision-making frameworks. Ethical decision-making involves reflection on each of the following questions. Who should make the decision? What are the possible options or courses of action? Because there's usually several. What are the available options and alternatives? What are the consequences of all possible options? That should always be considered. Which rules, obligations, and values should direct your choices? As nurses, we should always return to the nurse's code of ethics. What are the desired goals and outcomes of this situation? We are going to look at a couple of decision-making models that you can use when you confront an ethical dilemma. You don't have to use these models. There are many ethical decision-making models out there. You need to find one that makes the most sense to you, that you can remember, and that you can put into practice when you encounter an ethical dilemma. This model was developed in 2012 by the researcher E. Parks, and he proposed an integrated decision-making model that brought together all of the best aspects of various ethical frameworks. Parks found that the following 6 steps yielded positive experiences when nurses had to make difficult ethical decisions. As you look at this model, you will notice it sounds very familiar, as do most ethical decision-making models. They sound very familiar to nurses because we are familiar with the nursing process. And ethical decision-making is just another problem-solving process. So we're going to go through this model. It'll sound very familiar to you. First of all, you're going to identify the ethical problem. What is the issue at hand? You're going to collect additional information to identify the problem and develop solutions. Third, you're going to develop alternative decisions for analysis and comparison. Fourth, you will select the best alternative and give reasons why these options are the best. And this may have to do with what the family wants. You're going to develop diverse, practical ways to implement ethical decisions and actions. And last, you're going to evaluate the effects and develop strategies to deal with similar occurrences in the future. Another decision-making model that nurses often use at the bedside is the Morrow method. Many nurses prefer this model as the letters are acronyms and remind nurses of the steps of this model. First is the M, massage the dilemma. You will need to identify and define issues in the dilemma. Consider the options of the major players: patients, family members, nurses, physicians, clergy, and other interdisciplinary healthcare members. You also need to take into consideration their value systems. Next is the O. Outline the options. Examine all options fully, including the less realistic and conflicting ones. Make 2 lists. Identify the pros and cons of all the options identified. This stage is designed to fully comprehend the options and alternatives available, not to make the final decision. This is also one of the most time-consuming steps of the process, and a stage that can be revisited as new information becomes available. Next is the R, resolve the dilemma. Review the issues and options. Apply basic ethical principles to each option. Also, return to your nursing code of ethics. Decide the best option based on the views of all those concerned in the dilemma. Next is the A. Act by applying the chosen option. This step is usually the most difficult because it requires actual implementation, whereas the previous steps had allowed for only dialogue and discussion with the patient and the healthcare team. Last is the L. Look back and evaluate the entire process, including the implementation. No process is complete without a thorough evaluation. Ensure that all those involved are able to follow through on the final option. If not, a second decision may be required, and the process must start again at the initial step. Ethical decision-making is always a process. To facilitate the process, use all available resources, including ethics committees if the institution has one, and communicate with and support all involved in the process. Some decisions are easier to reach and support. It is important to allow sufficient time for the process so that a supportable option can be reached. Decision-making models will assist you in providing guidance and creativity needed in reaching acceptable and appropriate ethical decisions. This last ethical making model is by the American Counselors Association, and I've altered it a little bit for nurses to use because it is an excellent model. We'll quickly go through this one. First, you would identify the problem. Second, you would apply the American Nurses Association Code of Ethics for nurses. Third, you would determine the nature and dimension of the dilemma that you're trying to solve. So you would further investigate. You would generate potential plans of actions, different paths you can take in solving this problem. You would consider the potential consequences of all the options and determine a plan for action. You would evaluate the selected plan of action, and then you would implement the plan of action. And last, you would evaluate that implemented plan. This model very closely aligns with the nursing process, and so I thought that you may understand this one better. The purpose of this PowerPoint presentation and video is I want you to consider using one of these models in assisting you in completing assignment 4.2. So please refer back to this video.